Well, welcome back. We just got the 4-minute warning when the governor will walk out and address the state to give us the latest on the response of the coronavirus outbreak. In fact, there is the governor right now taking the podium, so we will stay on this as we will learn more from him, along with the latest numbers from DHEC.
Okay, y'all come on in. All right. Well, y'all, thank you for coming out again. We'll start with Chaplain John Denny.
Good afternoon. Since 1777, part of the state motto of South Carolina has read, "While I breathe, I hope." And that has continued, that spirit of South Carolina has continued through battles, through adversity, through trials that South Carolina has had. And that spirit is still alive today. So in that spirit, I ask that you please pray with me if you're a praying person. Gracious God, the Bible says, faith is confidence in what we hope for. It's evidence of things we cannot see. During this time, God, give us a faith, confidence, and hope in you. Help us to experience you in the whispers of our lives. Help us, with every breath, continue to have hope. And always help us to be South Carolina strong, South Carolina proud. Amen.
Amen. Thank you, sir. We also want to thank Holly May for being with us today and Josie McDaniel Burkett. Ladies and gentlemen, we have a good bit of information to give out today. We are making progress. The one thing I would like to announce is I've just issued another executive order that is a mandatory quarantine. We know that there are hot spots around the country. They've been identified, some very clearly, others are being identified now. But by the authority vested in me by the statutes and the Constitution, I've issued another executive order that requires those people coming into our state, regardless of whether they came from our state or someplace else, if they're coming to South Carolina from one of those hot spots, they must self-quarantine for 14 days, for 2 weeks. And there is a criminal penalty attached for failure to comply with that executive order. And the executive order mentions specifically the states of New York, New Jersey, and Connecticut, and also the city of New Orleans, all of which have been identified as hot spots. Dr. Bell.
Thank you, Governor. Good afternoon. As of today, South Carolina has confirmed cases of COVID-19 in 39 counties. This includes 86 additional cases across the state. The county-by-county case counts are posted on our website and updated daily. Unfortunately, it is with great sadness that I also report the loss of 4 more of our fellow South Carolinians who have been confirmed to have COVID-19 infection. And this brings the state's total number of deaths to 13. And as always, our sympathy and hearts go out to the family and friends of these individuals and to all of those who have lost their loved ones to COVID-19 infection. I can't express strongly enough the importance of all of us to take the necessary actions to protect ourselves, our families, and our community by continuing to practice social distancing, staying at home and away from others, and particularly when ill, and frequently washing your hands to prevent the spread of germs. DHEC has deployed 600 staff across the state to respond to this ongoing public health threat. And to date, we have responded to reports of 539 confirmed cases from our public health laboratory and private laboratories. Yesterday, we reported on a shortage of chemicals needed to perform testing on COVID-19 nationwide and within South Carolina, including at our DHEC Public Health Laboratory. But since that time, our innovative public health laboratory team has been able to recreate a component of our extraction supplies that was on back order and resumed testing late yesterday. The vendor supply arrived this morning, and currently the public health lab is working through a backlog of approximately 1,800 samples waiting to be tested. We also continue to work with healthcare providers to stay updated on the availability of hospital beds and ventilators throughout the state. This includes taking proactive precautions to increase the number of potential beds available. As of earlier today, our statewide hospital bed capacity was at 54%, with 6,734 beds currently utilized, which is a 308-bed decrease from Monday. In addition, 1,085 ventilators are currently available in South Carolina, and 180 are in use or at 14% capacity. While we continue to work with our hospitals to shore up beds and other supplies, we remind individuals that CDC has warned that this is a historic, unprecedented outbreak and that supplies are limited. We do not recommend that everyone who is ill get a test just to see if they have COVID-19 infection. For people with symptoms who wouldn't necessarily see a doctor, we advise them to stay home and get better if their symptoms are mild and seek medical care only if the symptoms are worsening. This will allow our healthcare systems and our providers to give care to those who need it most. It will also help protect those on the front lines at our hospitals, clinics, and other critical infrastructure areas so that they can continue to protect all of us as we work together to combat this disease. It is critical that we all do our part to protect ourselves and others, and to do that, we must be vigilant about taking precautions encouraged by public health experts. And for the latest information, please visit our webpage at scdhec.gov/COVID-19. Thank you.
Thank you, ma'am. Senator Graham.
Thank you, Governor. I know I speak for Tim. We're glad to be home. It's been a tough week in Washington. The President is going to sign the biggest relief package in the history of the nation just in a few minutes, $2.2 trillion. That's more than we spend on discretionary spending the entire year. It's larger than the New Deal. And there's a lot of things in there I don't like, but there are a lot of things in there that are going to save lives. I just got briefed by the governor and his team. I've never felt more proud to be a South Carolinian than I do now. People know what they're doing in that room. Your decision to stop elective surgeries when the hospitals and the doctors stepped up and said they would do that has created bed space in South Carolina a lot of people would covet. That was a great decision. Your decision to really impose social distancing in a serious way is going to help us with the infection rate. So we got a good team. We're in good hands. Now, what does this bill mean to you? Everybody in South Carolina who makes under $75,000 a year will be getting $1,200 as an individual, $2,400 as a couple, $500 per child. That is a lot of money, but it will help keep the lights on and the refrigerator stopped. If you're on Social Security and you haven't paid income taxes, you get a check. If you're on disability and you don't pay income taxes, you get a check. This money is coming. It's going to take a couple of weeks, but it will be coming. There's $150 billion in this bill to help states and municipalities and counties that have had to spend money they never allocated to deal with this virus. We've dealt with hurricanes very well. This is a hurricane that's not going to leave anytime soon. So this $150 billion will be a godsend to the state of South Carolina to replenish the coffers. There's another line item that is very important, $16 billion to buy the supplies we need to win this war. The special forces in this war are your nurses and your doctors and your healthcare professionals. They're the ones that meet the disease every day head on. The rest of us are soldiers in this fight. The war on terror, 1% of us have been fighting that war. The war against the virus, we're 100%, we're all in. What can you do? Follow the guidelines. This disease will be starved if we follow the governor's guidelines. It needs humans to transmit itself. The more we follow the guidelines, the more we starve the disease. Finally, there's sort of a war going on here between the virus and trying to stabilize the economy. Here's, I think, the strategy to destroy this virus. Between now and the summer, we're going to have to really focus on good containment policy to keep the virus from spreading. The more you do your part, the sooner we'll get out of this. Eventually, sooner rather than later, we're going to have therapies, Dr. Bell, drug therapies that will whack the heck out of this virus, that will make it less lethal, that will take it from a 10 to 1 or 2. And hopefully by the fall or the early part of the next year, we'll have a vaccine to kill it. Between now and then, it's going to get worse before it gets better. We're going to have an economy locked down for a while to come, and we'll reopen it based on sound science. The worst thing possible is to try to create a bump in the economy that leads to a spike in the virus. Heat is an enemy of this virus. I'm hoping we'll get some relief in the summer, but I know it's coming back in the fall. And the more we do now to get ready for the fall, the better off we'll be. So we're working overtime to find drug therapies to help people get through their hospitalization and maybe keep them out of the hospital, to take it from a 10 to 1 or 2, and the ultimate solution is a vaccine. President Trump is spending 24 hours a day with his team to do what we can at the federal level. This bill is going to help a lot. Help is on the way.
Thanks, Senator Graham. Senator Scott.
Thank you, Governor. Governor, and to those who have been doing these daily briefings, thank you very much. It certainly provides confidence to South Carolinians throughout this state. It provides information and it provides clarity. So thank you all for the hard work and the dedication that we see every single day on TV. It is making a difference. It is saving lives. I will tell you that perhaps one of the more heartwarming conversations I've had with citizens around the state is when you stood behind a podium and talked about having the buses bringing meals to the kids in neighborhoods. Whether you go to that school or not, folks who live in that neighborhood have been lining up in my hometown now of Hanahan to get access to those meals. I can't tell you the number of single mothers who've talked about how their conscience and their burden has been relieved and lifted because of what you and your team has done on behalf of people who are looking for hope. So I'm not sure all the good news. I do know that that is remarkable leadership from you. As it relates to the legislation itself, there are a lot to celebrate within the legislation. I'll name just a few. One, there's $4.5 billion going to the CDC, $11 billion specifically targeting vaccines and other therapies. There's $45 billion for FEMA to be able to ramp up around the country and bring more resources home. There's over $100 billion for hospitals in the bill, and specifically for small businesses that have been negatively impacted, laying off employees, seeing a drop in revenues. There's approximately $350 billion that you can tap into. The process is rather simple, not completely simple, but rather simple. It's basically a 250% of your monthly payroll would be the maximum loan possible. If you use the resources for your payroll or for your overhead, like your rent or your mortgage, that portion of the loan used for those purposes will be forgiven. Your first payment starts a year from now, and at that time, it would become a 10-year note with an interest rate not above 4%. The goal is to secure the relationship between employers and employees. The best and most effective way for us to stymie the utilization of the unemployment system is to give an incentive to employers to maintain the healthy relationship for employees. That is a really important and spectacular part of this legislation. There's certainly money for those businesses, what I just described is for 500 employees or fewer. For larger employees, mid-size and larger employers, there is a resource available through what we call a commercial facility paper that would provide loans as well.
Thank you.
Yes, sir.
Are there any questions?
Yes, Governor. Today,
Yes,
the
ma'am.
Attorney General said that basically cities don't have the legal authority to enact their own stay-at-home bans. What do you think of that opinion, and what do you think should happen going forward?
We have a very fine Attorney General and staff and Solicitor General, and their pronouncements are very good, I believe. The things that we have asked people to do from as you know, from the signs we've had on the side, the blinking that the Secretary of Education has put up for weeks now, saying stay home. All of these measures that we've taken, if everyone would do the things that we have suggested from this podium and otherwise, we would be in very good shape. One reason we're doing better than some of the other states now is because the South Carolinians are following these recommendations and suggestions.
Do you think the orders are that Columbia and Charleston put in place, do you think those are illegal?
Well, I'm concerned, and we are working to see that we keep as many people working as we can. We want to keep as many people safe as we can. We want to keep as many people out of harm's way as we can. We've issued orders on congregations or groups of 3 or more that law enforcement can disperse if they are a threat. We've closed the schools. That's 500,000 school children. Senator Scott mentioned how the meals in a quite remarkable fashion with Superintendent Spearman and her people have been able to get the meals to all of those people and more. We have urged people to keep that social distance, and those are the things that we are going to continue to do. We are following the science and the data and the knowledge and the experience of the experts like Dr. Bell and others in devising the precise path, the best and most aggressive paths that we can take. Next question.
What's the penalty?
Yes, was that a question?
Yes. With employees going to work, if there's an infection in their employment where they work, should that business shut down? What type of
what the
action
business
should they
should
take?
do is follow the recommendations and advice of the CDC, which has been provided many times by the Department of Health and Environmental Control. Would you like to respond, please?
Sure. We don't recommend that entire business shut down just because a single person has been identified with COVID-19. It can vary from the work setting, but in general, we focus on the close contacts, people who've had close, prolonged face-to-face contact with someone who is ill. And so the casual contacts who might be present in a business setting, it is of no value to actually close the business setting in that instance. We recommend closures and discourage large groups because of the possibility that there could be somebody in a population unrecognized, and that's how diseases spread. But we also want to maintain, as has been said, employment, and so they're really different situations. But there is, we know that there's a lot of concern about people saying that there may have been a worker in my work site who's ill, but that's not an indication to just close a business.
Dr. Bell, while you're there, MUSC's Dr. Edward O'Brien has said we could actually have 10 to 24 times the number of confirmed positive cases. Is that possible, that we could really have 11,000 people out there we don't know about?
Well, some of these projections seem unlikely, and they're based on comparisons to other populations that might not be valid. If we look at something like a New York City population that might have over 100 people per square mile versus in South Carolina, where we generally have fewer than 20 people per square mile. So our living conditions and other factors, when we monitor disease reports to make speculations about the shape of the curve, as I've mentioned, that there can be delays in reporting and there can be a large jump in reports on a single day that can frame the shape of that curve. But that is a factitious elevation in a curve just because samples are held. So some of this modeling is based on simply delays in reporting or delays in turning out test results. And what we believe is are more accurate representations is that we're unlikely to see an exponential rise in cases in South Carolina. We recognize that cases are going to continue to increase, and how steeply that increase continues depends on the effectiveness of the social distancing measures, and we can flatten that curve if people strictly observe the social distancing, stay home when you're sick, and that can change the shape of the curve. So there's a lot of speculation about that, but we doubt that will be that significant.
Next question.
Dr. Bell, how many kits does South Carolina have, and what's our capacity right now? And how often is DHEC getting these kits, and where are they coming from?
As I think you heard Dr. Bell mention, we were able to resume testing yesterday by bringing on more testing capacity in the reagents and the chemicals that we use. And so we also received some additional reagents this morning in the mail, and we have promises of additional reagents coming. So we have more than enough to get rid of our backlog at this point in time, and we have no indication that, at least in the coming days, that we're going to have a shortage. Now, as time goes on, we're going to have to monitor that. There are shortages around the country, and so we're going to watch that closely. So I don't want to promise you that we will be in perfect shape forever, but we're continuing to work with our providers around the nation to get the vaccine, including the CDC and including partners within the state that may be able to provide us supplies as well. So we're just going to have to watch it closely, and it all depends on the number of tests that come in, but we're good for the coming days at least, and we'll be able to make up the backlog this weekend.
You said vaccine, do you mean like the reagent?
The reagent, yes, absolutely.
Next question. Yes, ma'am.
Now, you mentioned that testing has resumed. How many days was it stalled for? How many days we had that shortage of chemicals?
Mr. Davis.
Thank you, sir. We had 2 days of a backlog of testing, and so at the state lab we pride ourselves in never having a backlog. So for us, 2 days was a lot. We understand that some of the private labs are significantly more than that, but we will by this weekend have made up that backlog and be back to same-day testing.
Next question.
Senators, I know it's early and the bill was just passed, but do we have any sort of breakdown in terms of anything, a specific amount South Carolina is getting?
Which senator?
If either senator can answer that.
The minimum is $1.25 billion for a state. It's $150 billion. They'll be working on a formula, I'm sure, based on some existing federal formulas. And as soon as we find out, we'll call the governor and make sure the money gets there as quick as possible. As to the individual checks, $1,000 per person, $500 per child, under $75,000. That's going to take a couple of weeks, hopefully no longer. Tim helped design the small business program. There are 1,700 restaurants in Myrtle Beach. Virtually all of them are shut down, and our goal is for them to be able to go to the bank, get a loan, keep the employees on the payroll, pay the rent, keep the lights on until this thing turns the corner, and we'll forgive that loan for 2.5 months if they'll keep people employed. That's going to take some time. There are 800 qualified lenders under that program. We're going to expand it dramatically. So it's going to take several weeks to get the money flowing, but when it does, it's going to make a difference. In the medical supplies, that's huge for our hospitals, the protective equipment. Just as soon as we can get the money flowing, the better.
Senator Scott?
Yes, sir. $1,200 per person, number one. I also would say that the formulas that exist within the federal government for division of resources throughout states will probably be tweaked a little bit as we think about the severity of the cases in different locations. There will probably be a formula that takes into consideration states that have high incidence versus states that have fewer incidents. That's why there is a minimum, as Lindsay talked about, of the $1.something billion. That minimum is going to be applied to all states because all states are being impacted, but there's a severity issue that we'll see more folks getting resourced accordingly.
Next question.
Senator Graham, you had a Facebook Live earlier today, and you said you had concerns about the medical supply chain. Do you believe that's hindering the U.S.'s ability to respond to this crisis now, or if it gets really bad?
So what have we learned? We've learned that our testing system is not where it needs to be, and people in South Carolina are allocating the tests they have available in a smart way. You can't test everybody. You want to test people who are really sick, and you want to test people who are in the healthcare front lines to keep them in the fight. 90% of antibiotic compounds are coming from China. So we're in a country now where 90% of the antibiotic supply chain is located in China. Our goal is to bring some of that back so we'll be less dependent. Our goal is to get the private sector involved in producing tests. Before the virus, it was a public testing program. The CDC and state public health organizations basically were in charge of testing. Now we're getting the private sector more involved in testing, and the goal by the summer is to have more tests. There are plenty of people that have had this and don't know it, and if we could find out that their antibodies are built up, they can go back to work with zero problem. So the sooner we get testing, the better. But in terms of bringing our supply chain back to the United States, that should be the #1 priority for the Congress for the rest of the year.
How should we do that?
Carrots and sticks. Carrots and sticks. Go to the medical companies and say, I understand you went to China because it's cheaper, but our country's at risk. We're at war with this virus. There are certain industries we got to control within the United States. You got to be able to feed yourself. You got to be able to make weapons. You can't depend on enemies to take care of you. So just go to the companies who've outsourced this stuff and say, bring it back. We'll help you bring it back, but you're going to bring it back.
Governor, if you could address the tourist ban. I mean, how do you enforce that? Will you have temperatures taken at the airports?
No, ma'am, we have not gotten to that. This requirement, it carries a criminal penalty. We hope that our visitors will be as responsible as the people of South Carolina have been in following the recommendations and the requirements. This is a requirement that has the force of law, and that's why it carries a criminal penalty. So we will implement that, and it is in effect as we speak.
What's the penalty?
30 days, up to 30 days in jail, or $1,000.
Governor, North Carolina has issued, Roy Cooper just issued a statewide stay-at-home starting Monday at 5 p.m. Are we headed down that path? And if we're not headed down that path, what makes you think, or you believe, what makes you think that we won't?
As we've mentioned before, everything is on the table. We will do whatever is necessary to see that the people of South Carolina are kept as safe as possible. And the main way to do that is to have the hospital beds available to do the other things that we've mentioned that we've accomplished. But the main thing is to have them follow the social distancing rules and the others about hygiene and all of those things that have been pronounced all over the place by the health authorities. I have not seen the order from North Carolina, but I know in looking at others and in speaking to governors around the country, including all in the southeast, I have seen nothing yet that was not all